Part A. Extract 1. Questions 1 to 12. You hear an oncologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, how are you feeling today? I know you had a bit of a reaction to the last round of chemotherapy.
Hi Dr. K. Well, honestly, I'm a little shaken. It all happened so fast during the infusion.
That's completely understandable. Can you tell me exactly what happened? What kind of symptoms did you experience?
Well, it started with a bit of itching on my arms, and then all of a sudden, I felt really flushed. My chest got tight, and I had trouble breathing. It was terrifying.
Okay, that sounds like a serious allergic reaction. Did the nurses attend to you right away?
Yes, they were amazing. They stopped the infusion and gave me some medication, and thankfully, the symptoms subsided quite quickly.
Are you still experiencing any of those symptoms now?
The rash has mostly gone away, but I do feel a bit tired and lightheaded sometimes.
I'm glad to hear it.
I'm also worried about my foot ulcer. It seems to be getting bigger.
An ulcer, you say? That's something new. Can you tell me more about it?
It started as a small blister a few days ago, but it's gotten quite red and painful. I'm worried it might be infected.
It's possible the allergic reaction or the chemotherapy itself could have compromised your immune system, making you more susceptible to infection.
That makes sense.
Now, have you experienced any other allergic reactions in the past, to medications or anything else?
No, never. This is the first time anything like this has happened. I don't understand why this would suddenly develop.
Allergies can sometimes appear out of the blue, especially with medications like chemotherapy drugs or even medications you've taken previously without issue. It's possible your body has developed a sensitivity to one of the components. Let's run some further tests to see if we can identify the specific drug that caused the reaction. In the meantime, we'll need to adjust your treatment plan.
What does that mean? Will I still be able to get chemotherapy?
We might need to switch to a different chemotherapy drug. We'll perform a test to see if you're allergic to a medication called docetaxel.
All right. Is that as effective as the last one?
It has a similar efficacy rate, but of course, there's always a chance it might not suit you either. We might also consider immunotherapy.
Okay, I've heard about that. What does it involve?
Mihiraa, it has emerged as a significant advancement in the treatment of cancer. It works by harnessing the body's immune system to recognize and attack cancer cells more effectively. We can discuss the details further once we have the test results.
Okay, that sounds good. But what about now? How will we proceed with treatment in the meantime?
We can try delivering the next round of chemotherapy at a slower rate. This might lessen the chance of another allergic reaction. We'll call it a low-dose infusion.
A slower infusion, huh? Will that still be effective?
It might be slightly less effective, but it's important to prioritize your safety. We'll closely monitor your response throughout the procedure.
All right, that makes sense. When will I be back for my next appointment?
Let's schedule you for a follow-up appointment in 2 weeks. We'll have the test results by then and can discuss the next steps in more detail.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. So, what brings you to the dentist today?
Hi, Darren. Thanks for seeing me so quickly. The truth is, I've been having this awful toothache on my right side for a few days now.
I see. Can you tell me a little more about the pain? Is it sharp, dull, throbbing?
It's a sharp pain, especially when I bite down on something hard. It comes and goes, but it's getting worse. Sometimes it even radiates up to my cheek.
Okay, and when did this pain first start?
Well, I can't pinpoint the exact moment, but it must have been sometime over the weekend.
It's okay. Anything else would you like to add?
Yes, I remember having some sensitivity to cold drinks a day or two before the pain started.
Interesting. Now, have you had any recent dental work done on that side of your mouth? Fillings, crowns, anything?
No, nothing recent. Actually, I haven't been to the dentist in a few years, I'm afraid to admit.
That's all right, Mihiraa. Have you tried anything to relieve the pain so far? Over-the-counter pain medication perhaps?
Yes, I've been taking ibuprofen, but it only provides temporary relief.
Right. Well, based on your description, the radiating pain suggests there could be an infection in the tooth or the gum tissue.
An infection? Oh dear, that sounds serious.
Don't worry, it's quite common. To confirm and determine the best course of action, I'll need to take a closer look. Let me examine your teeth.
Okay, sure.
I see some swelling around the gum line on your upper right first molar. There's also a small cavity on the chewing surface of that tooth. These findings support my initial suspicion of an infected tooth.
So, what can be done?
There are a couple of options. The most likely scenario is that we can treat this with a root canal.
I've heard that can be a bit uncomfortable.
It's true that it can be uncomfortable, but modern techniques and anesthesia minimize the discomfort significantly.
What does it involve?
This involves removing the infected pulp from the inside of the tooth and then placing a filling.
Is there another option besides this?
In some cases, if the infection isn't too severe, we could try antibiotics and a filling, but depending on the extent of the cavity. Ultimately, the choice is yours. However, I highly recommend treating this infection as soon as possible to prevent further complications.
Okay, I understand. I'd like to discuss this with my husband before making a decision. Would it be all right if I call you back to schedule an appointment, depending on what we decide?
Absolutely, Mihiraa. Please don't hesitate to call us back. In the meantime, you can proceed with the over-the-counter pain medication for pain relief.
Thank you so much, Darren.
That is the end of Part A. Now check the answers. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Emily, have you reviewed the updated influenza vaccination protocols? There's been some confusion between the high-dose and adjuvant formulations for elderly patients. The high-dose is for 65 plus, but the adjuvant one is also recommended for immunocompromised adults under 65, similar but not interchangeable.
Right, and storage is another layer. Both need refrigeration, but the high dose can't be frozen, unlike the standard one. We also have to confirm allergies. Egg-based versus cell-cultured matters if someone had a prior reaction.
Exactly. And timing. The protection peaks at 2 weeks, but some think it's immediate. We've had patients skip boosters, assuming they're covered. Also, the nasal spray is live attenuated, so avoid it in pregnant women, but it's fine for healthy kids.
Speaking of kids, the pediatric dose is half the adult volume, but the under 9s needing 2 doses is often missed. And with the adjuvant one, local reactions like soreness are common, but some mistake them for allergies.
Good point. Always check if they've had Guillain-Barré syndrome too, rare, but a hard contraindication.
Now look at question 26. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Bennett, we have a situation with Mr. Thompson. His cephalic vein collapsed during the 3rd-4 attempt. He's dehydrated, but his labs show near normal electrolytes, so it's not just hypovolemia. His skin turgor is poor, though, and he's been on diuretics long-term.
Did we rule out infiltration from the last attempt, Mihiraa? Sometimes swelling masks a vein rupture. And was the catheter size appropriate? A 20 gauge might be too rigid for his fragile vasculature.
No swelling, and we used a 22 gauge this time. His veins are sclerotic, likely from years of chemo, not just age. But interestingly, his VP is stable, so it's not a circulatory volume issue alone.
Chemo changes the vessel elasticity. And if he's on corticosteroids, that could explain the lack of inflammation despite trauma. Let's try ultrasound guidance and switch to a midline catheter, less mechanical stress.
Agreed. Also, his albumin is low, which wouldn't help venous integrity. Should we hold the diuretics temporarily?
Not yet, his CHF takes priority. But hydrate aggressively first.
Now look at question 27. You hear a nurse called Mihiraa talking to a physiotherapist. Now read the question.
Daniel, I've been getting severe leg cramps halfway through my shift, mostly in the calves. I hydrate well and take magnesium, but they're getting worse. My electrolytes were normal last check, so it's not just low potassium.
Are you wearing compression stockings? Poor venous return from prolonged standing could cause cramping, even without varicose veins. And do you stretch before shifts? Tight gastrocnemius muscles mimic electrolyte cramps.
I do wear stockings, but I've been skipping stretches since the ward got busier. Oddly, the cramps start around 2 p.m., always after my second coffee. I thought caffeine dehydrates, but my urine output's normal.
Caffeine isn't the culprit if you're hydrated. But it's a vasoconstrictor. Reduced blood flow to overworked muscles could trigger spasms. And if you're leaning forward during med prep, that shortens the hip flexors, straining the calves indirectly.
That makes sense. My posture's been awful since we switched to electronic charts. Maybe it's a mix of mechanics and caffeine?
Likely. Try dynamic stretches pre-shift and swap one coffee for electrolytes. If it persists, we'll rule out nerve irritation.
Now look at question 28. You hear a doctor called Mihiraa talking to a head nurse. Now read the question.
Evelyn, we need to address the staff shortages in the ICU. The nurses are stretched dangerously thin. I know we've had budget cuts, but patient safety is being compromised.
I've requested agency staff, but administration says it's too costly. Meanwhile, burnout is skyrocketing. 3 nurses called in sick this week alone. The overtime shifts aren't sustainable.
It's not just about numbers. The new admissions protocol is adding paperwork, eating into direct care time. And with the electronic records transition, even experienced nurses are slowed down.
True, but the real bottleneck is the lack of senior staff. We have plenty of new grads, but they need supervision. Without enough mentors, mistakes happen, like yesterday's delayed med administration.
That's the critical issue. We can't just throw bodies at the problem. We need trained bodies. Maybe we fast-track mentorship programs instead of hiring more juniors?
That could work, if we get approval. But until then, we're stuck in this cycle.
Now look at question 29. You hear a doctor called Mihiraa talking to a patient. Now read the question.
Mr. Dawson, your latest blood work shows a concerning drop in hemoglobin. It's at 9.8 now. I know you've been fatigued, but let's rule out causes. Your B12 and folate levels are normal, so it's likely not nutritional.
Dr. Mihiraa, I thought it might be my vegetarian diet. I do eat spinach regularly though.
Iron from plants isn't absorbed as well, but your ferritin levels are borderline, not critically low. More importantly, your stool test showed occult blood. That's likely the real issue. Have you noticed any abdominal discomfort?
Just occasional heartburn, but I take antacids daily. Could that be related?
Actually, prolonged antacid use can mask GI bleeding symptoms while worsening iron absorption, a double-edged sword. We should schedule a colonoscopy to check for ulcers or polyps before adjusting your meds.
So Dr. Mihiraa, the antacids might be hiding the problem while making it worse?
Exactly. Stopping them abruptly could cause rebound acidity though, so we'll taper carefully after the scope.
Now look at question 30. You hear a doctor called Mihiraa talking to a patient's carer. Now read the question.
Dr. Mihiraa, I'm careful with his diet, plenty of chicken and eggs, plus those nutrition shakes. Could it be his diabetes making him lose weight?
Dr. Mihiraa, I'm careful with his diet, plenty of chicken and eggs, plus those nutrition shakes. Could it be his diabetes making him lose weight?
His blood sugars are controlled, so that's unlikely. But I notice he's on a new diuretic. Are you tracking his fluid intake? Excess urination could cause dehydration, mimicking malnutrition.
He does drink less since starting those pills, but his swollen ankles improved.
That's the paradox. The diuretic helps edema but may impair his appetite. More crucially, his denture issues persist. Is he avoiding tough meats despite your preparations?
Now that you mention it, Dr. Mihiraa, he pushes food around his plate.
There's our real problem. The mechanical difficulty of chewing undermines even perfect meal plans. Let's get his dentures adjusted and switch to soft protein sources like flaked fish.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a general practitioner, Mihiraa, and an interviewer. Welcome, Dr. Mihiraa. Thank you for joining us today to discuss the intricacies of patient management systems within general practice. To begin, could you walk us through how a general practice functions on a day-to-day basis?
Thank you for having me. A general practice operates as a multifaceted system where patient care is at the core, but the structure itself is deeply integrated with administrative, diagnostic, and preventive measures. At first glance, it may appear that the primary role is consultations, but in reality, we navigate between acute and chronic case management, public health initiatives, and administrative logistics. The practice functions as an ecosystem where different professionals, doctors, nurses, receptionists, and allied health staff coordinate to create seamless patient experiences. For instance, a patient's journey from booking an appointment to receiving long-term treatment involves layers of electronic records, referrals, and multidisciplinary collaborations. A well-run practice is one where these aspects blend cohesively, allowing for continuity of care.
That sounds incredibly complex. Given this, what makes general practice so crucial in the healthcare system, Dr. Mihiraa?
The importance of general practice extends far beyond being a mere gateway to specialist care. It serves as the foundational tier where early diagnosis, preventive medicine, and holistic patient relationships take shape. Many assume general practitioners, GPs, are simply intermediaries between patients and hospitals, but we are also disease mitigators, behavioral health guides, and long-term care providers. Imagine an elderly patient with multiple comorbidities, hypertension, diabetes, and early signs of cognitive decline. Without a general practitioner monitoring these conditions, complications could escalate unnoticed, leading to preventable hospitalizations. Additionally, general practice addresses public health concerns by offering vaccinations, mental health support, and lifestyle interventions. Our role isn't just about treating symptoms, but about constructing long-term health trajectories for individuals and communities.
With so much responsibility at the core of general practice, patient management systems must be integral to ensuring efficiency. Dr. Mihiraa, how effective is the current system in supporting these needs?
This is where the conversation becomes nuanced. While modern patient management systems have certainly streamlined many processes, electronic health records, EHRs, automated appointment scheduling, and telemedicine, there are inherent inefficiencies. Some systems are clunky, requiring manual data entry that diverts clinical time away from patient interaction. Others struggle with interoperability, making it difficult for healthcare providers across different settings to access unified records. There's also the issue of information overload. GPs often face a flood of data that isn't always structured in a way that facilitates quick decision-making. While digitization has enhanced accessibility, it hasn't necessarily optimized efficiency to the extent we envisioned. The reality is that our current patient management systems are a patchwork of different software platforms that don't always communicate well with one another, causing bottlenecks in real-time decision-making.
Dr. Mihiraa, given these challenges, how do general practice teams navigate working effectively with patients within the current system?
Adaptability and teamwork are at the heart of general practice. When technology fails or creates friction, human intervention compensates. The receptionist plays an integral role, serving as the first point of contact and ensuring that urgent cases are triaged appropriately. Nurses provide a crucial bridge between the GP and patient, particularly in chronic disease management. Meanwhile, GPs themselves must juggle immediate medical concerns with long-term patient education, ensuring that individuals understand their treatment plans and take an active role in their health. Despite the occasional technological setbacks, the team relies on strong communication, professional intuition, and structured workflows to ensure patients receive uninterrupted care. However, it is worth noting that even within an efficient team, gaps still emerge due to systemic shortcomings in our patient management frameworks.
What do you believe could be done to improve the patient management system to better serve both practitioners and patients, Dr. Mihiraa?
Refinement is essential. First, integration across different healthcare sectors must be prioritized. Hospital databases, general practice records, and specialist reports should seamlessly connect. Artificial intelligence and predictive analytics could be leveraged more effectively to flag high-risk patients and personalize treatment plans. Moreover, user interfaces need to be more intuitive. Many systems feel like they were designed for administrators rather than clinicians. Additionally, incorporating real-time patient feedback into the system could allow for more dynamic adjustments in patient care. At present, while automation has increased, it hasn't necessarily translated into better patient-doctor interactions. The goal should be a system that enhances efficiency without compromising human-centric care.
That brings us to the final question. Dr. Mihiraa, what obstacles hinder the development and implementation of a more advanced patient management system?
There are several roadblocks. First, financial constraints. Healthcare budgets are often stretched, and upgrading systems requires significant investment. Then there's the issue of regulatory complexity. Data security laws and compliance frameworks can make innovation sluggish. Additionally, resistance to change is a major factor. Many healthcare professionals, accustomed to legacy systems, find new interfaces disruptive and time-consuming to learn. Finally, the question of data ownership remains contentious. Should patient records be universally accessible, or should institutions maintain exclusive control? Until these hurdles are addressed, we will continue to experience fragmentation in patient management systems.
Now look at Extract 2. Questions 37 to 42. You hear a presentation by Dennis Carlos, a dentist at Mihiraa Healthcare Institute. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. It is an honor to be here today to discuss the exceptional research and development initiatives at Mihiraa Healthcare Institute. As a dentist who has worked closely with Mihiraa Care, I have seen firsthand the transformative impact of innovative healthcare research, particularly in the realm of dentistry and general medical practice. Mihiraa Care has long been at the forefront of advancing patient-centered approaches, integrating cutting-edge technologies, and refining treatment methodologies to improve healthcare outcomes. The research at Mihiraa Healthcare Institute is built upon several key sectors that drive its mission. Dental sciences, regenerative medicine, medical imaging, AI-driven diagnostics, and public health initiatives form the backbone of its research endeavors. Each sector is deeply interwoven with Mihiraa Care's holistic philosophy, ensuring that research isn't isolated within individual disciplines, but collaborates across fields for the most effective healthcare strategies. For instance, the intersection of dental sciences with regenerative medicine has allowed Mihiraa Care to pioneer bioengineered tissue replacements for patients with severe periodontal disease. Similarly, advancements in AI-driven diagnostics are being developed to enhance early detection methods in oral cancer screenings. The commitment to multidisciplinary research ensures that the solutions emerging from Mihiraa Healthcare Institute are not only innovative, but also deeply practical in real-world applications. Understanding patient needs is at the heart of Mihiraa Care's research process. However, the assessment of these needs is not as straightforward as one might assume. It isn't solely based on symptomatic reports or clinical data. Rather, it involves behavioral analytics, genetic predisposition assessments, and predictive modeling. Mihiraa Healthcare Institute has pioneered patient-centric research models where feedback loops are integrated into treatment plans. For instance, in dental care, patients' behavioral tendencies, such as dietary habits, brushing patterns, and stress indicators, are studied alongside clinical markers to create tailored interventions. This approach extends beyond dentistry. Mihiraa Care implements similar methodologies across all its departments, ensuring that treatment plans are not just reactive, but also proactive. The institution's unique approach to need assessment means that research is continuously refined, adapting dynamically to real-time patient responses. The main focus of Mihiraa Healthcare Institute is not just technological advancement, but the enhancement of patient experiences and outcomes. The integration of technology into medical and dental fields must serve a purpose beyond automation. It must elevate the quality of human care. One of the primary focal points is the balance between precision medicine and holistic treatment methodologies. In dental sciences, for example, Mihiraa Care is researching the effects of personalized microbial profiling to determine how an individual's oral microbiome influences systemic health conditions like cardiovascular diseases. The idea is that dentistry should not be confined to oral health alone, but should be integrated into the broader medical landscape. This principle extends to every aspect of Mihiraa Healthcare Institute's research, ensuring that innovation is not just about the latest tools, but about redefining healthcare paradigms. Innovation at Mihiraa Healthcare Institute is marked by its relentless pursuit of solutions that bridge the gap between research and application. One of the most groundbreaking developments has been in minimally invasive dental procedures. By utilizing nanotechnology in dental restorations, Mihiraa Care is revolutionizing how fillings, crowns, and implants integrate with natural tissues. Similarly, AI-driven diagnostic tools have been developed to analyze radiographs with greater accuracy than conventional methods, allowing for early-stage detection of anomalies before they manifest clinically. Beyond dentistry, Mihiraa Healthcare Institute has also developed bioengineered graft materials that significantly reduce post-surgical recovery time. These innovations are not just about scientific breakthroughs, they're about bringing tangible, measurable benefits to patients, ensuring that research translates into better, more efficient treatments. But how are these developments analyzed to ensure their efficacy? Mihiraa Healthcare Institute operates on a rigorous evidence-based validation model, where every new research initiative is tested across multiple phases before implementation. Longitudinal studies are a core component of Mihiraa Care's analytical process, tracking patient progress over extended periods to assess the true impact of an intervention. The use of real-world data collected through wearable health devices allows researchers to observe how treatments perform beyond the controlled settings of clinical trials. The emphasis on continuous assessment ensures that advancements are not merely theoretical but demonstrate sustainable long-term benefits. The interplay between AI-driven predictive models and human clinical evaluations ensures that the research output maintains both accuracy and adaptability. Looking ahead, the future of Mihiraa Healthcare Institute's research is focused on further refining precision medicine, expanding the use of smart biomaterials, and enhancing AI-assisted diagnostics. The next frontier for Mihiraa Care is the integration of blockchain technology for secure patient data management, ensuring that patient information remains accessible yet protected. Additionally, research into gene therapy for periodontal regeneration is a promising avenue, one that could redefine how we approach severe dental conditions. The focus isn't just on immediate innovations, but on developing infrastructures that will allow future breakthroughs to emerge seamlessly. Mihiraa Care believes that research should not only address present challenges, but also anticipate the needs of future generations, setting the foundation for a continuously evolving healthcare landscape.